Good afternoon, everyone. Thank you for joining us. Today is our Advocacy in Action, RPA's Capitol Hill Day 2021. Today, we're going to give you all an overview of what to expect during your Capitol Hill visits, and hopefully this information will help you make the visits easier and give you just some comfort and knowledge of what to expect and the best way to advocate for your nephrology practice. So I'm going to turn it over to Robert Blazer, RPA's Director of Public Policy, and he'll start our session. Thank you for joining us.
Thanks, Desiree, and welcome everybody, and thank you so much for participating in our Hill Day. We really appreciate it. Really looking forward to it, so I'm going to go ahead and get started. First, I want to talk about who's with us. Of course, we have nephrologists, practice executives and or managers, and our kidney patients and relatives. We welcome our patient advocates from the American Association of Kidney Patients. Thank you for being with us as always. So as of press time, we had 30 states represented that are listed there and 62 advocates. And by the way, in late 2020, the immunosuppressive drug bill passed, so give yourselves a round of applause. That's why we do this, to get bills to pass. And we had a huge victory at the end of 2020. So that's why we do this, and thank you for everything you've done with us over the years. In terms of an overview, I'm going to turn it over to my colleague, Lincoln Clapper with Advocacy Associates. He's going to talk about the platform and how everything's going to work for Hill Day. Then Lincoln will give it back to me, and I'll talk about what's going on the Hill right now, our legislative priorities, logistics and what to do and what to expect, and then next steps and follow-up. And with that, I believe you're on, Lincoln.
Thanks, Rob, and good afternoon, everyone. My name is Lincoln Clapper. I'm part of the Advocacy Associates team here in DC, working with RPA for your virtual Hill Day next week. And I just want to spend a few minutes to open up, walking you all through your online portal, which you will be utilizing for your Capitol Hill schedules, and sort of walking you through some of the features on how to navigate that platform appropriately. So that being said, I'm going to share my screen here and we'll get this thing going. So let's do this. Trying to hide this bar here. There we go. Okay, so you all will be getting an email from us on Tuesday. That would be, if you're watching this as a recording, Tuesday, May 18th. It'll come from Advocacy Day at advocacyassociates.com, highlighted here in green. So keep an eye out for that domain. Within that email will be a link to your schedule, and that's highlighted here in red. So it's a unique link specific to your schedule. You don't need to create an account. You don't need to create a password. Just click on that link and you'll be automatically logged into your dashboard. Now, if by close of business, say May 18th, you haven't gotten this email from us yet, check your spam or junk folder, and more than likely ended up there. If you do find it there, please unmark it as spam, as this will be our main way of corresponding with you. And so we want to make sure you're getting all of that correspondence. Now, just to start off, I wanted to go over just a few troubleshooting issues. So if at some point you become logged out of your schedule by accident, there's also some scenarios where certain browser settings may not save cookies properly, and you may inadvertently become logged out. You're going to end up at a login page that looks like this. And so what happens is, if you end up at a page like this, the login page, just click on the Send Me a Sign-In Link button. Don't try to enter a username or password. Just click that button there on the bottom, and then enter the email address that you registered for this event with, and then you'll get a new refreshed link to your schedule from our system, automated. Now, if for some reason you're still not able to get in at that point, just click the Support tab in the upper left corner. From there, you'll be able to indicate that you're having trouble accessing the account. This will go directly to our development team. And so if you have any issues at all, this is the best and fastest way to get the issue resolved. Don't contact Rob. Don't contact anyone at RPA or your state captain or colleague. Go to the support tab. That will be the fastest way to get the issue resolved. Now, once you're logged into your schedule, you're going to see all of your confirmed meetings on the top part of your page with a time. If there's any pending, they'll be listed on the bottom as TBD. We've got about 80% of your meetings confirmed at this point. So by the time we get to Tuesday, the vast majority of these should be confirmed, if not all of them. But if there are any pending, you'll see those as TBD. You'll actually get a notification from our system as well as they become confirmed, just to keep you updated on your schedule. Now, please also note the times that you'll be viewing are displayed in Eastern time. And this is really important to keep in mind as you plan your day accordingly. I'll be going over some information later about how our system actually sends automated reminders to help keep you on track. Now, in order to access the content for each meeting, all you want to do is click on any part of that module with your mouse. From there, you'll be launched into that specific meeting dashboard. You'll see the time and date of the meeting displayed at the top, as a reminder, followed by who you're going to be speaking with. So whether it's staff, member of Congress, or both. If RPA has assigned a meeting lead to your meeting, you'll see that person's name displayed there. If not, then this area will be blank. In order to access the video component of the meeting, just click that Join Online Meeting button. That'll open up your video component. 99 out of 100 meetings are going to take place on the Zoom platform. So expect that dashboard to come up. There are a few offices that have dial-in only policies. So for those meetings, there will be a disclaimer on the button letting you know that there's no video capability. But again, most, if not all, will have video capability to them. Now, you, of course, will also have dial-in for each meeting too. That information will be displayed beneath there. So if you can't access via video, just follow the directions here, enter the access code when prompted, and you'll be launched into the meeting room via dial-in. All of your talking points will be displayed in the upper right-hand corner, followed by any supplemental documents to supplement those talking points. Just simply click on each document. It'll open up in a separate tab. It will not close your schedule. You'll be able to have your schedule, your documents, and your Zoom platform all open at the same time, and will make it real easy to navigate between the three. Beneath that will be a list of the attendees who are in that meeting with you. There may be some relevant contact information displayed there. If there's not, you can also message each other through the platform through our peer-to-peer chat function. So just click on that blue chat bubble. You can send a direct message to another advocate. If somebody is trying to message you through the platform, you actually will get a notification about that from our system. On the left-hand side is our report form area. The first one's the check-in feature. Just click that button either before or after the meeting, letting us know that you checked in, because we're going to be sending this attendance report to Rob, and you don't want the principal, Rob Blazer, contacting you for missing class. So just indicate that you were there, and we'll make sure that RPA is notified that you were present for these meetings. You also have a capability to send a thank you email after the meeting concludes. So you can open this in one of two ways. Click that blue open email button at the top, which will open the native email platform on your computer. So for me, that's Outlook. So if I were to click on that, it would pull up an automated Outlook email. If not, if you don't have anything like that, you can click those copy clipboard buttons and then paste it into your Gmail or Yahoo or anything, or whatever email platform you prefer. The script will already be pre-crafted for you by Rob and his team. You can obviously personalize and customize it if you'd like, but the bulk of it will already be preloaded for you. Beneath that is the meeting report form. So this is a standard, feedback questionnaire. Go through, please answer each of these after each meeting. These are specific questions Rob and his team would like you to answer. So just go through one by one when the meeting concludes. When you get to the bottom, click submit, and then you can navigate your way back to the home page. Beneath that is an option to take notes. This is essentially just a blank notepad. If you don't have pen or paper handy, you can take bullet point style notes here as the meeting progresses. It's optional. You don't need to utilize it. It's really just an extra resource for you. Beneath that is an option to select whether the member of Congress was present or not present. For those of you that have done this event before, you know the meeting may be scheduled with the member of Congress, but they get pulled away to votes, or they're stuck at a committee hearing and they're not able to make it. Just helps us get a very accurate accounting on who was present, and just helps with the appropriate follow-up after the meeting concludes for the RPA team. And then lastly, for you social media fans, you'll be able to access your Twitter, Facebook, or LinkedIn directly through the portal as well. As long as you're logged in, or just all you need to do is log in, you can drop a post on any of those platforms as well. Now, once the meeting concludes, just click on that meetings tab in the upper left corner and navigate your way back to the home page. The legislators tab will take you to an area where you can view bios for each member of Congress, such as this. It'll have links to all their social media pages as well. So if you want to visit their website or go to their Facebook page or look up their Twitter handle, you're able to do that. If you're tracking any particular bills for this event, you'll see that information displayed here, along with the vote history if it's been voted on. If you're not tracking any bills, this area will be blank. The news tab will pull any relevant news articles that member of Congress has been mentioned in. You can read about those on your free time. And the committees tab will display all the committees that member of Congress serves on. The last three options on our top menu bar are the messages tab. That's where you can view those direct peer-to-peer messages. The directory is a master directory for everyone in the event, so you're not just limited to the people in your meetings. And the support tab, as I mentioned in the beginning, will be your best friend for anything technical, scheduling support, any support you can think of. Go to the support tab, fill that out. That'll come directly to our team, and we'll get that issue resolved as quickly as possible. The more section is basically just a drop-down menu of all the content I've already reviewed, just a way to access it from the homepage, and you can see how that operates when you get logged into your portal. My last slide here, just want to spend some time on relevant information and reminders. Again, check your spam or junk folder if by close of business next Tuesday you haven't received that email from us. Our domain is @advocacyassociates.com. Some of you may need that in your settings to unmark us as spam. We're asking everybody to call or get into the video portion of their meeting 5 minutes prior to the start time on your schedule. This is really just to ensure everybody in your group has touched base about roles, and also to make sure everyone's present when the office joins so the meeting can start on time. Again, all times on your schedule are listed in Eastern time. However, you're going to get a reminder email from us 1 hour prior to every single meeting throughout the course of the day with a link to your schedule. So this will help keep everybody on track across the various time zones. It'll also make it very simple for you to get in and out of the portal. So don't feel like you need to keep one email draft handy to re-access your schedule. Every correspondence you get from us will have a link to your schedule. If an office doesn't join the meeting within 10 minutes past the start time, please have everybody hang up, designate somebody from your group to contact us. Our help number will be listed in the support tab if you need to call us for a time-sensitive issue like that. Staff and members of Congress are, run late just like anybody else. But please do give them a 10-minute buffer time to join before contacting us. Meetings may last anywhere from as little as 15 to as long as 30, so just prepare your pitch and talking points accordingly. Really important to ask the office in the beginning of the meeting how much time do they have, and that will really get you in the right direction. Any changes to your schedule the day of the event will be sent via email, so again, make sure you're checking that regularly throughout the course of the day. Make sure you're in an area with good Wi-Fi connection, as again, most, if not all of your meetings will have a video capability to them. Please mute your microphone whenever you're not speaking, whether it's on dial-in or computer, and know your audience. Ensure you have an appropriate background, as you'll be speaking with most Republicans and Democrats throughout the course of the day. So that being said, looking forward to a very successful event last week. And if there's any questions in the chat, I'm happy to answer those now. It looks like there's a few in there. It looks like there's not, actually. Never mind. So I'll turn it back over to Rob to take it from here.
Okay, thank you. And hopefully everybody can hear me. I'm going to talk about the current Hill environment right now. And for the early days of the Biden administration, there's been a lot of bipartisan talk, but partisan action. For as much as the president's been saying we want to do everything in a bipartisan way, that has not occurred yet. Of course, what happened in January and COVID seemed like they're going to permanently alter Hill activities. Maybe not, but I would venture to say we're going to be feeling the effects of this for a long time. Of course, there's a real bitter political divide going on right now, and no great news there. And it's been that way for a while, and I think it's going to continue. Of course, the Democrats have control of Congress, and that this lets them set the agenda and chair the committees and things like that. But there's still a lot of things that have to be worked out. It's going to be pretty hard to achieve bipartisan legislation in this Congress, but not impossible. I just read today that they're going to have a bipartisan commission on January 6th, so that required some agreement. I would guess police reform might be on a short list of things that could happen and that sort of thing, but it is going to be hard to happen. And of course, the Biden administration is proceeding with all of their proposals so far on a partisan basis, as I noticed. What's going to come up next is the more COVID-related relief and infrastructure. Before they had the American Families Plan, now they're going to be working on the American Rescue Plan, and that's pretty much dominating everything right now. Now, in most years, you'd say anything major that's going to happen would only be through budget reconciliation, which in years past could only happen once a year. Now, Senate Majority Leader Chuck Schumer has been exploring with the with the Senate parliamentarian about ways to get around that, but this is a risky thing for him to do. He might not want to do that because then it sets a precedent for the other party to do that when Democrats are out of power. So maybe he doesn't want to do that. So it's not impossible there could be more than one budget reconciliation legislation this year, but hard to say. Of course, there's a 50-50 Senate split right now with the vice president splitting ties. So you would think that only motherhood and apple pies issues are going to get through, and that's with 60 votes. That's why you have to have budget reconciliation. That can happen with 51 votes, but otherwise it's 60 votes. And that's where all the talk about getting rid of the filibuster that would allow things to pass with 60 votes is coming from. Although, again, that's a risky thing to do because then whoever's in the party by one or in control by one vote can make anything happen. Now, even though, it's going to be tough to proceed on some of our issues, telehealth might be in that sweet spot. All of the bills that are out there right now are bipartisan. I'm going to talk about them more in detail in a moment. But, it seems like telehealth could occur. But otherwise, if it's not telehealth and we don't have another round of budget reconciliation, the use of the 2022 appropriations process is probably the only way that anything's going to happen. The fiscal year ends September 30th. Chances are there will be continuing resolutions to fund the government until later in the year. But they're going to have to eventually get through 2022 appropriations. And that might be a bill where things like, say, telehealth or maybe living organ donation could get added. So we'll see what happens from there. Excuse me. In terms of our 2021 legislative priorities, codification of improvements and further enhancement of living organ donation, enactment of legislation that permanently eliminates the originating site and geographic restrictions on the use of telehealth in the U.S., and omnibus kidney disease legislation. I'll talk about all these in a second. In terms of the living organ donor bill, it came out in February, and you can see the bill numbers there. It addresses barriers to organ donation by prohibiting the denial of coverage or increase insurance premiums for living organ donors, designates organ donation surgery as a serious health condition for the purposes of the Family Medical Leave Act. That's what FMLA stands for, Family Medical Leave Act. And it requires the government to update their educational materials on living organ donation. You can see the co-sponsor numbers in each chamber. 22 in the Senate is a pretty big number. That's a good thing. Now, this bill is expected to go through some legislative refinement, i.e. sausage making, in a couple months. The language of the bill this year is slightly different than it has been in past years. I think we would prefer the previous language, but that process is going to play out in the coming months, and we'll have to see what happens with that. But either way, of course, we're in favor of the Living Donor Protection Act. We'll just have to see exactly how the language plays out. So on telehealth legislation, there are several bills out there. There's one that's specific to COVID-19, HR 366, the Protecting Access to Post-COVID-19 Telehealth Act of 2021, and the CONNECT Acts. And I don't have the acronym for CONNECT, but this is a telehealth bill that's been out in previous Congresses as well. You can see the bill numbers there. All of these bills do a lot of the same stuff. They permanently remove the originating site and geographic restrictions on the use of telehealth and Medicare, and that would be a great thing because that will allow telehealth the way it's being used now during the public health emergency to become the way it will be permanently. It allows permanent waiver authority during public health emergencies. PHE stands for public health emergency. So this allows CMS to always make the call during a public health emergency to waive telehealth restrictions to the extent they still exist then. There are required studies on telehealth utilization and waivers, and it provides additional resources for oversight. And important to us, it doesn't interfere with the current home dialysis interactions. There are some telehealth bills out there that would permanently remove the requirement for a quarterly face-to-face visit with home dialysis patients. RPA is not in favor of this. So we are in favor of the bills that don't do that, don't address the waiving the requirement for home dialysis face-to-face interactions quarterly. So anyway, those are the bills. We're supportive of all of these bills. Again, the broader message is to pass telehealth legislation that takes care of originating site and the geographic restrictions and doesn't interfere with the home dialysis setup as it is now. Next slide, please. So with regard to the community CKD bill, this has not been introduced yet, so we don't have bill numbers yet. Does some great things, though. It increases access to the Medicare kidney disease education benefit, and it expands the annual wellness benefit to include kidney disease education screening. It promotes a sustainable pathway for innovation. You know, one of the problems with a bundled payment system, and it's particularly the ESRD payment system, there's no way to pay for innovation. So that's a problem. You know, in a lot of ways, dialysis is the same as it was 20 years ago, even though there's been some profound technological advancements since then. So that's a problem. This would help address that. Modernizes the quality payment programs in kidney disease, in dialysis, I should say. Guarantees access to Medigap policies to all ESRD beneficiaries, regardless of age. Reinstates dialysis services as subject to the Medicare Advantage network adequacy requirements. We were quite upset last year when the Medicare Advantage rule came out, where dialysis patients would be covered under Medicare Advantage plans. And what they did was they did not subject dialysis services to the network adequacy, which is to say time and distance standards. They said, you know, normally they'll say you have to be within a half an hour or 30 miles of a provider of service for whatever care you get. And they excluded dialysis services from that with the understanding or the thought process that home dialysis could fill the gap. Everyone wants to encourage home dialysis, but we don't think that's appropriate for everybody, so they shouldn't have done this. So this bill will take care of that gap. And again, the bill hasn't come out yet. Steve, next slide, please. So what are other relevant legislative issues? The Healthcare Workforce Resilience Act came out last year, and what this would do would be to take unused visas that would otherwise be time expired and run out, and give them to immigrant healthcare workers, physicians and nurses who are living in the U.S., have residency in the U.S. So the visas wouldn't be wasted, and it would make sure the healthcare workforce isn't adversely affected by this visa issue. And we have endorsed the bill. We are also looking for increased funding for the kidney health policy initiatives, such as the NIH stands for National Institutes of Health, and NIDDK is the NIH Institute where kidney disease is housed, kidney disease research. Looking for a $285 million increase for that, and for Kidney X, which is the innovative program for developing new kidney innovations, that would be for $25 million. And there's some reason for optimism here, because it seems like this Congress kind of has its head on straight in terms of having to fund medical research. So we think there's going to be good news there. Another thing that's out there is there's legislation promoting staff-assisted home dialysis. And while this on its face is a good idea, the bill is still in its very early stages and seems like a long shot at best. There hasn't even been a bill introduced yet, but there has been language floating around the Hill. And then there's legislation that would create a dialysis facility-centered payment model. And this is as opposed to the current models that are out there in the Innovation Center by CMS, promoting CKD care, home dialysis, and transplantation. This would be a newer version of the Better Act that came out last Congress. And again, this seems like a long shot because it seems as if the community is not really behind it. Next slide, please, Steve. So in terms of the logistics, delegations are by state as per usual, and some are going to be bigger than others as per usual. Constituents should lead the discussions with House staff because, again, if you're in a state delegation, you might have, 3 or 4 or 5 people, and you won't be in the same congressional district. Of course, you're all from the same state, not from the same congressional district. The constituents should lead the discussions with the House staff. And of course, patients and physicians have been paired together as much as possible. Next slide, please. So gauge the environment. And, this is kind of different now because it's not as if you're going into an office anymore. But when I say gauge the environment, I'm kind of talking about the fact that, you're not going to go into Mitch McConnell's office and urge him to pass Medicare for all legislation. That's just not going to happen. So you want to think about the office you're visiting and the things that you're going to say to them. Of course, our issues are kind of motherhood and apple pie. but still you want to be kind of mindful of who you're visiting and how you're going to talk about it. So you want to tailor your message on this. You want to check the sponsorship status of whoever's office you're meeting with on our legislative priorities. We really have like 3 or 4 bills out there we care about. This will be included in your resources, and you'll be able to check to see, Senator Grassley did sign on to the workforce bill, so you can thank him for that. Or if he didn't sign on, you can say, please co-sponsor this bill for us. So you want to prepare your message, determine the lead speakers in advance, and I'll probably send out the emails for all the groups. So if folks want to have an email conversation in the days leading up to Hill Day, you can do that. You want to highlight the links to the community and use real world examples. You want to talk about and say, in St. Louis at this hospital, we have this issue. And, you want to anticipate a counter argument possibly. They might say, well, that costs too much. Why should we pay for that? And you can say, well, actually, it's going to save money in the long run because you're going to make care better and keep people out of the hospital or something like that. So next slide, please. So what do you do when you get there? You introduce yourself, you advise the staff that you're here to talk about kidney disease, and you tell your story. I mean, you're just talking about why I'm here. This is important. This is what we want you to do, and this is why we want you to do it. And, for first timers, it really is easier than you think. There's been a lot of folks over the years who are very nervous about doing this, and then they walk out of their first visit and they're like, oh, I made that harder than it is. It's really not hard at all. So next slide, please. So what gets a congressional office's attention? Your patients and your physicians, their constituents, your community, your practice and healthcare delivery environments, and your ongoing participation and engagement. So you want to begin a relationship here. If this is the first time you're ever doing this, figure out who the staffer is you're interacting with, send them an email, and then 6 months from now, send them another email. Or if something happens with the bill, send them an email or say, hey, just checking in, hope you're well. If you ever need any help with any issues with regard to kidney policy, contact me. So, definitely try to keep the engagement ongoing as time rolls on. Next slide, please. So, the whole thing is, the whole KISS mentality, keep it simple, sweetheart. So you want to keep it short. You want to keep it simple, make it personal, listen carefully. One of the things, what'll happen when you get into a Hill visit, you're all caught up in what you're going to say and what you want to say. Make sure you listen to what they're saying too, because that could be key into getting their participation, their co-sponsorship, their help with doing the things that we're asking them to do. And like I said before, always follow up. Make sure you send an email afterwards thanking them. And then, again, like I say, sometime in the future, 3, 6, 12 months, send them another email saying, hey, just checking in, hope everything's okay, and let me know if I can be of any assistance to you. Next slide, please. So next steps and follow-up, I guess I've already talked on this a little bit, but get the contact information, send a thank you note. You can invite the members of Congress and their staff to your practice, to your dialysis facility, or wherever it makes sense. Of course, when it's safe to do so, although I think we're getting into a safer time now. You want to follow up with unanswered questions. Don't feel nervous about saying, I don't know the answer to that, but I'll get back to you, because that's going to happen. I'm not going to say it's going to happen a lot, but you can anticipate that happening. They're going to say, well, how many dialysis patients are there in Missouri? And you can find out that number and get back to them, or something like that. There's going to be, there often are unanswered questions, and just make sure you respond back to them. And again, stay in touch, and please give us feedback via the e-survey, and there's also be the survey that Lincoln spoke about a little while ago earlier. So next slide, please. So in terms of social media, absolutely spread the word. Take pictures for social media use. And I know these are going to be Zoom calls, but you see a lot of Hill days where people are taking a picture of their Hill day and then posting it to their Twitter account, or they could put it on their Facebook account and say, we met with Congressperson Malone's office today, and had a great meeting with Tom from Malone's office, and we appreciate his time and everything. The pictures on Twitter in particular really crank up engagement and crank up people looking at the tweet. So take pictures when you can. Of course, there's all the different platforms where you could do it. it's good to thank the congressional offices on Twitter as well. You can say, had a great visit. Thank you so much, Mary Jo. I appreciate it. There's the hashtag RPA advocacy, and also be sure to tag @kidneypatients and @RPA nephrology. Next slide, please. So, I know I have these lines here every year, but it's because they're true. This matters because you can never doubt that a small group of thoughtful, committed citizens can change the world. And indeed, it's the only thing that ever has. From Margaret Mead. Next slide, please. All in all, it's another brick in the wall. Now, I got this from years ago. I said on a Hill Day, somebody asked me, does this really make a difference? I mean, we're going in and talking to some 25-year-old staffer, and it absolutely makes a difference. That's how the immunosuppressive drug provisions got passed, because we had spent years putting bricks in this wall to make this happen. And then one of my favorite quotes is from former manager of the Baltimore Orioles, Earl Weaver, who said, "Everything affects everything." And this just refers to this does matter. When you're in there, this affects the passage of legislation. This will have an effect, whether you think it does or not. So please do so. Next slide, please. And there's all the contact information for RPA, for myself, and for AAKP. So please feel free to reach out to us. Steve, I see there's 17 participants. I'm looking at the Q&A. I don't see any open questions or any in the chat box, but if you have questions, you can feel free to ask them now. And I really apologize for the problems that we had before, folks. Sorry about that. And so it's all on me, by the way. It's not on Steve or anybody else. It's because I'm a low tech kind of guy. Questions, comments? Well, I'll tell you what, it's one. The slides are going to be sent. There's a question, are these slides going to be available on the RPA site? We're going to be sending the presentation to everybody. Maybe we can edit out the part where I was talking with no slides. But we're going to send this the whole webinar out to everybody, hopefully before the end of the day today. So you'll be able to go over the slides again. But I can also send the slides out to everybody if that's useful as well. Other questions, other comments? Well, I guess I don't want to belabor this. I appreciate everybody taking the time out of their day to listen to this. And again, this will be available otherwise. And thanks so much for participating. And we'll look forward to hearing how everything goes next Friday. Thanks so much. Take care.